Hey guys, Dr. Michael Derry here. So we're going to talk about the two major differences I see when treating sciatica versus treating stenosis. And so some people think they're the same. They can be similar in ways, but there's two major differences that can really make or break the recovery and treatment. Let's go over those things right now. Okay, stenosis and sciatica are similar in that they can be a space issue. And so when we think of stenosis, the intervertebral foramen or the space in your back is decreasing either from time or bone spurs or just older age, right? So you have a decrease in space that makes the nerve angry. Those nice, beautiful nerves in your lower back can get angry when there's not enough space. Similar in sciatica in that you have some sort of encroachment on the nerve, which could be from a disc herniation, or maybe you have some inflammation around the nerve in the lower back. But stenosis can happen anywhere, and sciatica is only in the sciatic nerve and the lower parts of the spine that come out and go down your leg. And so they're similar in that they're both a space issue, but they're very different in that sciatica tends to be in a younger population and that you can have pain in your glutes and buttock and go down your leg, whereas stenosis tends to be in an older population, and the hallmark sign of stenosis is what's called neurogenic claudication, and that people with stenosis, as they walk, they start to have pain in their back or down their leg, and as they sit down, they flex their spine and the pain goes away immediately. Those with sciatica, that will not happen, okay? So you can have pain while walking and upright, but when you go to sit down, it's not an immediate relief. It's a very different clinical presentation in that stenosis tends to be high up and very low, zero discomfort, where sciatic, you don't really see that big a roller coaster of discomfort or pain. They can both have numbness and tingling or sharp radiating or radicular pain down the leg, right, which feels like an electrical fire going down your leg, but one tends to hang around, sciatica, and one tends to kind of go away immediately when you sit down or flex forward. And so those with stenosis or sciatica, the treatments are very different in that with stenosis, we tend to use more flexion-based programs to improve symptoms. If you have sciatica caused from a disc herniation and we go to flex you, you're not gonna like whoever you're working with because that's just not gonna work for you. And so they're similar in that there's both space issues. They're different in that they have a different clinical presentation and a different, what we call clinical signs and symptoms, in that what you do in your daily life change your signs and symptoms. And so sciatica often have compression somewhere around the nerve, and if you go to sit down and put compression on the nerve, it can cause discomfort. Stenosis, when you go to sit down, you typically have relief right away. You flex your spine, it feels really good. You do a flexion-based program to get you feeling better, and then use that to build upon to get you up and walking and feeling better. So those with stenosis typically don't like walking for long periods of time, and that when I treat people with sciatica, a big thing that they do love is that when they get up right away, they can feel not so great, but as they continue to move, they start to feel better. So those are two big differences that I see when treating stenosis and sciatica and how they present in the clinic. And so to review, stenosis tends to be in older adults, older individuals. They have neurogenic claudication, and that when they walk, they have symptoms that start to build and go down their leg, but when they sit down, they have complete relief. And that those with sciatica, that typically does not happen, and that they typically feel better as they walk longer and are moving more because you're nourishing that nerve with blood flow, which is really good because you want to get the inflammation out of there. And so two big differences there that can really have an impact on your recovery and how you treat it. Whew. Guys, if you like that information, please subscribe to the channel or leave a comment, anything you've learned. Those are just two things, the big things that I see and the big differences. Otherwise, there's many more that can get into nitty-gritty, but those are two big differences. And so please subscribe. As always, guys, stay healthy, keep moving, and take care of yourself.